Hi everyone, I'm Dr. Alisa Kauffman from Geriatric House Call Dentistry, and I am here with Dr. Josephine Weber from San Francisco live, and we are in Las Vegas at the Mobile Dentistry and Teledentistry Conference, having so much fun. And we are here with Dr. Josephine Weber's partner on FaceTime because she couldn't come. She has small children and someone has to work. Dr. Bautista. And the questions that I want to ask you are concerning oral health, preventive care. I think that most people don't realize that how important it is to brush your teeth. And when they look in their loved ones' mouths, they usually call me and say they haven't been to the dentist for years. COVID has not made things better. They can't get them to the dentist. And when they look, there's so much plaque, there's so much, looks like rocks, hard stuff. Can you address how important oral health care is, oral care, preventive care, is to your systemic health? Dr. Bautista, what do you say to your patients when you see these mouths?
You know, the first thing that I always tell them is, your mouth is where most of the bacteria is. And if the bacteria if you eat and you swallow and you drink, and all this bacteria can travel throughout your body. And if it travels throughout your body, you wonder, how does that impact the rest of our body? Because of bacteria. So the bacteria can get stuck and, throughout your arteries, into your heart, into your brain. It causes pneumonia. It has all these different effects, and even for, pregnant women, it also has premature babies. So there's so many different ways that our oral health affects our entire body.
Sorry, we're dealing with technology. Dr. Bautista got a call from a friend. It can't be that important. I hung up on them. Dr. Bautista, so when you go in there, do you often find that the caregiver is this important? Okay, we're going to just hang up on them and we're going to just go on, and I hope you guys are laughing at home. Do you often have to tell the caregiver how to take care of the teeth, that you're not happy with the way they are taking care of the teeth?
Yeah, I stress that, the same plaque that's clogging the arteries, it's the same plaque that's found in the mouth. So I tell them, if you can't get in there with the toothbrush, get in there with the gauze and just really get the plaque off their teeth and their tongue, because of all the other things that it can cause, like pneumonia and even worse than that, you can get a heart attack from that.
I have one pet peeve. I want to know if you guys agree with me. When you go in there and you ask the caregiver, because the teeth look terrible, are you not brushing the teeth? And they say, sure, and they bring out what looks like a lollipop with a sponge on it. And I actually have to say to the caregiver, if your fingernails were dirty, would you just take a sponge and clean your fingernails with a sponge? And they're like, no, that doesn't get under the fingernails. And I'm like, exactly. So I try to tell them that the sponge is great if there's food that's stuck between the teeth and the gums, but that is not cleaning the teeth.
No, not at all.
And we don't expect you to go in there and floss if they're biting, if they're kicking and screaming. But most of the time, I think that even the dementia patients, they recognize a toothbrush and they allow you to do it.
Yes.
And there's ways that we can help you. We can give you bite sticks so that they can keep the mouth open. Do you recommend any special products? Do you give products out?
Oh yeah, my best friend is the gauze or the baby washcloth, because it's so thin that you can get in there. And I always try to teach not just the patient but also the caregiver how to clean their mouth, and they do, because then it gets better. And then the patients, when we come back, they tend to know what we're doing and we're not there to hurt them, and they know that we're there to help.
Listen, there's a lot of challenges that we know that you as caregivers face. We're there to help you. I think that, even if you think that your loved one or your patient or your husband or your wife is not going to cooperate, we get in there and we help them. Wow, you have a lot of friends. We really should have put you on Do Not Disturb, but what do we know? We're not technology experts. Anyway, so if you are, we're having so much fun. This is fun. We love our jobs. So if you have a loved one, preventive and oral care is so important. Let us come in, let us evaluate. We're gonna tell you what products to use. If they swallow the toothpaste, we're gonna recommend a toothpaste that you can swallow. We are gonna tell you what products you shouldn't be using. Some are not safe for this population of people. But the cleaner your mouth, the cleaner your body.
Yes.
So if you need any oral preventive care in the Bay Area, you're going to call Dr. Josephine Weber and Dr. Bautista. They are partners. So you're going to get one of them. And they are a great team. So fill out the form of the Geriatric House Call Dentistry in our app and put as much information as you can, and we will get back to you as soon as possible. Looking forward to meeting you and your family soon. So take care.